Welcome to Doctor's Corner. So excited to have Dr. Dzineku here from Tripod Fertility and his right-hand lady, Nina, his nurse. We are talking today about the third-party process and going into detail a little bit about what my role is, and then when I hand it off to the clinic, how they take it from there. So when somebody applies to our program specifically, we go through many steps, and a surrogate has to have bloods, infectious disease screening, urine drug screening. They need a recommendation from their doctor. We go through a lot of vigorous screening things so that when we send them over to the clinic, they have less work to do. The idea is that we can have a very good indication that they are prepared to move forward and that they are medically able to move forward. So the bonus is then, if they're with Tripod or if they need a referral, we send them over here, and then Nina takes it over, and I will send what's called a match sheet or a referral sheet that I do. And usually I send along profiles so that people understand a little bit about the patients, so that when they speak to them, they have a face to put with the name. And then Nina will take it over and explain to us kind of her part in that.
Yes, so we receive a very detailed profile from Angela. I quickly review all the documents, make sure there are no immediate red flags that would cause this person not to be approved as a surrogate at our clinic. Everything looks good. I connect with the surrogate and I connect with the intended parents, saying that a match sheet has been received. The files are being reviewed by the doctor, and we book the initial appointment with the doctor so that they can review the files, order any additional investigations that are needed, and then it's off to Dr. Dzineku.
Thank you. And so at this point, when we get a patient in front of us or in front of the Zoom or whichever it is in this COVID era, we obviously have a very well prepared file because it's gone through Angela, it's gone through our nursing, and so on and so forth. And so that's a great advantage because they're essentially pre-screened and they're quite a way into it. But what we do, the first thing that we do, and I say we because there's always two physicians involved when there's a surrogate involved, is that we split the file. So one of the physicians, myself or Dr. Roumain, will see the surrogate, and one of the physicians will see the intended parent or parents. And the idea is that you can't possibly be looking out for the best interest of both parties simultaneously if the best interest of one goes against the best interest of the other one. So essentially, you can't be the lawyer for the accuser and the accused in a court of law, and it's kind of the same thing. You want to be able to look out for what's best for your patient without having in mind the other party. So once we do that, the person who's seeing the surrogate will evaluate whether there is any contraindication to having a pregnancy, any previous history, any previous complications, anything that would be a red flag that we shouldn't be doing this. And the person who is talking to the IP will, again, look at the medical history of the IP, see if there's any genetic issue that we need to look out for, if there's any other issue that we need to look out for, and come up with a plan in terms of how to get the embryos, because this is surrogacy, so how to get the embryos either transferred if they already have embryos somewhere, or how to create embryos here to then do an embryo transfer with the surrogate. And then usually once that is said and done and we have the final okay, everybody's kind of looped in. Angela, I'm assuming that the counseling, the psychological counseling and everything has been done by you initially if they come from you. Anyways, once all of that has been done, then we proceed and hopefully get a pregnancy. And
once we have kind of everything gathered together, we've helped coordinate the legals so they have contracts in place, and we have the counseling done, and everybody's prepared to go forward. Then where do you guys take it over as third party and start to initiate the cycle process?
Yes, so as soon as we get medical clearance from the doctor, we reach back out to the intended parents. We get an idea of what timeline they are looking or they're interested in. If they want to move forward right away, we do our best to organize with the surrogate, how quickly we can get the embryos. We do an education session to make sure the surrogate understands how to do the cycle monitoring, what an embryo transfer process would look like, and any medication that's involved. And then we proceed as soon as both parties are able.
So does that mean that there's, sort of video involved, the third-party coordinator? What does she do in terms of making sure the surrogate understands her requirements in terms of medications, all that kind of stuff?
Yes, the third-party coordinator would mainly reach out to them and organize all of the primary things like the counseling, like the legal. Once it gets to the cycle, then you'd move over to our nursing team, and we would go more in depth on what you can expect from your cycle, how can you do your medications, and more medical related questions related to your transfer.
So there you have it.